Unprofessional interactions can be easy to notice, but difficult to address. The good news is that with the right approach, these conversations can become opportunities for growth rather than conflict. Hi, I'm Amy Gardner, Associate Dean for Faculty Development and Director of the Academy of Medical Educators here at the University of Colorado Anschutz School of Medicine. In the next few minutes, hear from Dr. Abbey Lara and learn her practical tips to navigate unprofessional behaviors effectively.
Have you ever witnessed a learner or colleague behave in a way that just didn't sit right, but you hesitated to say something? Maybe it felt awkward, or you weren't sure how serious it was. The truth is, unprofessional interactions often go unaddressed, not because we didn't notice it, but because we didn't feel equipped to respond. As educators, mentors, and leaders, we play a critical role in shaping professional identity. Addressing unprofessional behavior isn't just about correcting someone. It's about maintaining a safe, respectful learning and clinical environment. When we avoid these conversations, small issues can escalate, impacting team culture, patient safety, and learner development. Research in medical and professional education consistently shows that early, direct feedback improves positive behavior and reduces future lapses. Frameworks like Speaking Up for Safety and Just Culture emphasize timely, respectful conversations that focus on behavior rather than personal judgment. Individuals who report that clear expectations and constructive feedback help them to grow, even when feedback is difficult to hear. Hi, I'm Abbey Lara, a pulmonary and critical care physician and the Associate Dean of PATH, the Office for Professional Excellence, Accountability, Trust, and Humanism, here at the University of Colorado Anschutz Medical Campus. In this role, I support our teams to navigate challenging conversations and promoting professional growth in our learning and working environments. Today I'll share 5 practical strategies that you can use to confidently address interactions that seem unprofessional in nature. First, recognize and name the behavior. The first step is being clear about what you're observing. Instead of labeling somebody as unprofessional, identify the specific behavior. For example, you arrived 20 minutes late without communication is much more useful than you're demonstrating poor professionalism. This keeps the focus on observable actions and reduces defensiveness. Second, address it early and directly. Timing matters. Waiting too long can make the issue feel bigger and harder to address. When appropriate, try to have the conversation as soon as possible, ideally in a private setting. A simple approach might be, "Hey, can we talk for a minute about what happened earlier?" This signals the conversation is important and not punitive. Third, use a structured conversation approach. Having a framework can make these conversations feel less intimidating. One effective method is the describe, express, ask approach. Describe what you observed, express your concern, and ask for their perspective. For example, I noticed you interrupted the patient several times during the visit. I'm concerned it may have affected how heard they felt. Can you tell me what was going on for you in that moment? This approach invites dialogue rather than delivering a lecture. Fourth, focus on impact and expectations. It's not enough to point out the behavior. Connect it to why it matters. Help the recipient understand the impact on patients, team members, and the learning environment. Then clearly state expectations moving forward. For instance, in our department meeting, we're prioritizing giving others time to speak without interruption. In the future, allow others to finish before responding. This turns the conversation into a learning opportunity. And finally, document and follow up. When appropriate, document the conversation and revisit the issue. Follow-up shows that professional expectations related to interactions in the workplace are taken seriously and that growth is expected over time. It also provides a chance to reinforce improvement. I've noticed you've been a lot more mindful about not speaking over others. Great progress. Recognition is just as important as correction. Addressing unprofessional behaviors doesn't have to be confrontational or uncomfortable. When done early, respectfully, and with a focus on professional development, these conversations strengthen trust, improve team culture, and support growth and development. These strategies work best when expectations are clear and applied consistently across environments. The next time you notice a moment of unprofessional behavior, don't let it pass. Pause, reflect, and take one small step. Name the behavior and start the conversation. You don't have to be perfect, you just have to begin.